Let's start. Good morning and good afternoon to people who are joining the session. My name is Ajay Bailey. I'm a professor at the Utrecht University in the Department of Human Geography and Spatial Planning. We're very happy to host this session for Winner. It also kind of consolidates many of the linkages that we have between our universities and universities in Indonesia. So some of this research is part of this ongoing collaboration. Um, whom do we have today? Next slide, please. Or can I also go by myself? Yeah, I can think I can go myself. Yeah. We have together with me, we have Dr. George Doudward from the Utrecht Medical Center and from Utrecht University, Professor Dianta, who will join soon, and Professor Sondang Irina, whom I also met here when she came to the Netherlands, and Danielle. So Danielle has been very instrumental in getting us together and organizing this session. Thanks, Danielle, for that. Um, let's go to give you a quick overview. So I will give a short introduction to how what we think from a geography and spatial planning perspective, how we come into this discussion on planetary health and the focus on WASH. And then we will have Professor Dianta, then George and Irina who would continue, and then we will get some the first experiences or results from Daniel's work in Jakarta. There will be some time for discussion, and then we wrap up this. The session takes place at a very opportune moment because at this moment in the Netherlands, we have the Planetary Health annual meeting going on. It's a conference where we discuss these different issues and also how it impacts both in the global north and in the global south sense. Yes. Um, so, if you have questions on what you expect from the session or whatever comes to your mind in relation to planetary health and WASH, please add that to the window where you can add these questions and we will get back to them. So, when we think about planetary health lens, what do we mean by that? In a sense, it can you may have heard of global health, you may have of public health, you may have heard of environmental health. So, what is this new term that brings us together? In our work that focuses at Utrecht University on the linkage between the geography or geosciences and health sciences, we focus this year on 2025. The theme for Utrecht University is on the healthy planet. And within this healthy planet, we look at it from a very multidisciplinary perspective. We each come from our own background, be it medicine, anthropology, geography, sociology, urban studies. We come from different backgrounds, but we all have the same focus on this healthy planet. Uh, there is a link over there based on an earlier talk that I gave. If you're interested, please have a look at this part. So, what differentiates planetary health in relation to the other elements, such as public health or global health or One Health, is this element of that it is transdisciplinary, that it's not just focused on research, but actually focused on providing solutions. It brings in this issue of equity, brings in issues of justice, while recognizing that justice and equity issues are not just for human population but also for non-human population. So this kind of at the conference yesterday they spoke about interspecies justice, and that's part of what planetary health actually advances and creates that space for these transdisciplinary interactions. uh, I don't know how visible this is on your screen, but this was we had the opportunity to see Sam Myers in person yesterday, who presented this work, looking at how different elements come together within as underlying drivers or ecological drivers to create impacts on health. And when we think about wash, for example, wash occurs across this whole continuum, right from water quality up to infectious diseases, right from viruses and pathogens to availability of toilets, right from housing and clean air to fuel to cook food for, or clean fuel, for example. All these elements come together, especially they intersect to create more vulnerabilities for people who come from lower socioeconomic backgrounds. Uh, Under the slide, there is a reference to this paper. I would highly recommend people to read it as well. But when we think about planetary health, the common element also comes together is focusing on climate adaptation strategies. So we don't just look at planetary health from, okay, it's a new framework, but rather thinking about how is this framework helping us better explain what is happening around us or the interactions between the human and the Earth's natural systems. And these climate adaptation strategies, often defined as adjustment in natural or human set systems in response to climatic stimuli, be it heat or floods and other kind of elements that push us into looking for these climate adaptation strategies. But often climate adaptation strategies in relation to mitigation or adaptation, we are no more at this stage where we can say let's choose either of them. We are at a stage where both of these are necessary, be it here in Utrecht or in Jakarta or in India or in Brazil. We are dealing with these issues. Adaptation strategies are not just about technical solutions, but also about bringing in this issue around equity and justice. How do these adaptation strategies benefit certain groups while excluding other groups who are not recognized by the state, who are not recognized by the governments, whose settlements are not recognized? Hence, adaptation strategies that we promote from a planetary health perspective in relation to improving access to wash services, we should take equity and justice as a key element there as well. Let's see my slide. Yes. One of the elements that we bring from the international development studies or the human geography perspective is the focus on intersectionality. That it's not just one size fits all kind of an approach, that inequalities accumulate over a period of time and create worse living conditions or more precarious living conditions. For example, someone who is older coming from a minority background, living on their own with lower access to resources, would face greater inequalities as compared to someone who's just focusing on aging. So hence, in most of our project, we look at these intersectional elements. How can we reduce these intersectional inequalities? And many of the structural inequalities further increase vulnerabilities for these groups. For example, if the settlements or areas are not recognized, if housing is not provided by the state, then any intervention that one takes from an NGO or from other groups is very short term, because you are not solving the structural inequality of provision of housing and clean water, for example. So when we think about solutions, because the whole idea of having a planetary health approach is to arrive at these transdisciplinary solutions, we need to think about how these solutions can be inclusive and equitable. It's not an easy task because such a diverse population that exists. But for every moment, we have to take this intersectional lens to see who is the group that is most affected by these processes and how can we give them better services. This is what we are currently doing in some many of our projects. Say, for example, the one with Daniel will present, but also in projects in Pune, where we look at how women coming from different backgrounds have greater inequalities based on their age, based on income, based on access to resources, based on availability of a toilet in their house, for example. All these elements combine together to create these wash inequalities, and these wash inequalities can either get worse over a period of time depending on their age and access to resources, or it could also improve. But and people have agency within these neighborhoods, within these settlements, to bring about change as well. So whenever we think about solutions, it's about co-creating these solutions. In another project that we focus on infectious diseases, there we look at how waste management actually uh, further affects quality of water, because waste disposal not being um, regularized creates more contamination of water. The greater contamination of water means that people who cannot filter their water, or who do not have access to filtering processes, get further affected by these infectious diseases, or these pathogens that come through this water. Um, So, key approaches for planetary health and climate adaptation strategies, especially in relation to wash, would be we need to integrate these solutions. We cannot talk about housing interventions without talking about wash inequalities. We cannot talk about healthcare interventions without looking whether they have access to basic and safe water and safe sanitation. As I've said earlier, these transdisciplinary solutions are only possible and successful when they are co created in collaboration with local communities. How this collaboration happens, how co creation is possible, is very diverse. It depends on the context, depends on how the communities are able to also decide for themselves. But that's no excuse not to do it. We still need to go ahead with these collaborations. We need to go with these co-creations, and always bringing in these processes the systems thinking, how changing one aspect of it has an impact on the broader system, or how impacts of air pollution or impacts of water pollution at source has an impact and downstream in terms of health outcomes for children, for older adults, in that sense. So bringing in this systems thinking and interacting also with this human non-human interactions, because with what we see now, and this is not much discussed within the wash part of it, but with the AMR or antimicrobial resistance, we see in the impact of it on water quality, especially drinking water quality, and how that increases people's risk because of increasing use of antibiotics or these kind of medicines for poultry and for other groups, that these pollutants come back into the water. So when we think about where is the water polluted, it's not just from one thing, but on this combination of different elements that we need to put together. I think that's my last slide. So I always use this quote saying that being a planetary citizens, or focusing on these kind of wash inequalities, we don't need to go outside in space to look at it, but rather recognize that we share this planet, recognize that we share the outcomes, and that we have a role to play in taking care of our common home. Thank you. I'll stop there, and then I give the floor to Professor Dianta. Very welcome. We don't hear you.
Uh, I didn't. I can't hear your
Yeah,
voice.
you're not very
Yeah.
audible, Professor Dianta. Is it? Can you check for your audio?
No. Sabrina? Oh yeah. No, I can't hear your voice now.
Mm, change this.
No. Sabrina, can you help us? What's happened with the end audio? Oh, Mbak Dianta, in the three button on the black box, please allow the microphone. On the device setting, you can allow the mic. Yeah, the button gear. Yeah.
How about now?
Yeah, it works.
Okay, great. Okay, thank you very much. Sorry for the hassle, everyone. A very good afternoon. My name is Dianta Sumantri. I'm from the Department of Medical Education. I'm also a researcher in the Indonesian Medical Education and Research Institute. And my topic for today is about education for planetary health. Because I'm from the Department of Medical Education and I was appointed as the person in charge for the Kata Earth project, a project of a consortium involving Indonesia, Bangladesh, and several other countries led by the Utrecht University. So, in this very short timing for presentation, I would like just to highlight three main points, a bit of introduction of why educating for planetary health is important, and the available approaches for planetary health education. And last, which will be the bulk of my presentation, I will describe the Kata Earth initiatives. And here we have also George in the panel. He's the leader of this project, and I'm from the representative from Indonesia. So I would have to acknowledge all of the members of the consortium in the Qatar Earth Project from Spain, from Bangladesh, from Indonesia. There are Universitas Indonesia and also Universitas Gajah Mada, and of course led by the UMC Utrecht. And this project is fully funded by the European Union. So why planetary health education? Okay, so there is an increasing imperative and mandate across the education space for transformative, inclusive, integrative, and sometimes disruptive approaches to learning that strengthen our capacity to work towards the goals and imperatives of planetary health. So I guess we all are fully aware of the climate change and its impact, but we have to think whether planetary health, climate change, have been systematically incorporated into our curriculum at all levels of education, and how our teachers, our support system in the education institution, be it in the basic education, secondary, and until tertiary education, are well prepared to assist our students and our graduates to be able to navigate the challenges and the impact that is occurred due to the climate change. So, in education for sustainable healthcare, we need to fully aware and enact in the process of equipping current and future health professionals with the knowledge, values, and confidence and capacity to provide environmentally sustainable services through health professions education. Um, in medicine, we may not be fully aware that medicine has contributed a very significant amount of carbon footprint. Many utilities used in the medical and healthcare service has significant contributions to climate change. So I think it's imperative that now we start to think of how we can deliver a more sustainable healthcare, and also equip our students and our graduates with the awareness of how can they make the healthcare service becoming more sustainable. And I think that really needs to start from formal education. So, how planetary health education is being approached? Here are some of the approaches that are used. So we see here in this diagram that planetary health education is very much a continuous process from the preclinical to the residency program. From the preclinical stage, we can expect students to learn about the health outcomes as a result of from the exposure to climate change. It can be delivered through lectures and small group sessions. Whereas in the clinical setting, where they meet real patients, interact with real healthcare professionals, and encounter real case situation, they can learn about the pathology of climate-related disease during the clinical encounters with patients and learn about disparities in the outcomes. So we can still use lectures and case studies, but I think the most dominant methods used in the clinical stage would be um, case discussion. So, working on a patient and then discussing the patient with the consultants to learn more about the effect of climate on the health of the patients and how to minimize the impact and how to mitigate the challenges. In the residency program, I think it's quite similar to the clinical phase, but of course more complex because in the residency program they are learning some specialty in each of their own field of medicine. So they learn more about how the resources available to protect patient health, to understand the structural reasons behind disparities, and so forth. So it is more a hands-on experience and hands-on learning experience for the residents to learn about the impact of climate change for the patients. So basically, we expect a lifelong learning process of all healthcare professionals, starting from where they become, first becoming students, and up until they do their professional practice throughout. There needs to be a full awareness of how healthcare service contributed to the climate change and how can we have a more sustainable healthcare service. From this diagram, perhaps what I would like to highlight is the column on the right hand side. So there needs to be regulations, or they call it here formal ratification. So it needs to be formally acknowledged as part of a curriculum, and a very important one. And we need to prepare our teachers, because if we are teachers now, we are not fully equipped on how to help students to learn about planetary health and the effect of climate change and how to mitigate them. And we have to provide the knowledge and the resources, and basically this is a very transdisciplinary approach. So let me talk about a little bit about the Kata Earth Initiative. So this project, it stands for Catalyzing Transformative Change in Planetary Health Education. The aims is to develop planetary health education in climate vulnerable regions. And this project involves strong community engagement. Each institution will have to have at least one community partners. Together with the community partners, we're going to develop the curriculum, the training of trainers program, and then to conduct the educational modules with the students. This project involves partners in Netherlands, Spain, Indonesia, and Bangladesh. Um, we have total of 7 partners, and the duration of the program is about 36 months. And these are the objectives: to build capacity for designing and delivering innovative, community-driven planetary health education, employ community-engaged learning and challenge-based learning methods, and go using co-design, co-develop, and co-deliver approach, and create a new generation of change makers with actionable knowledge and skills. So here are the outputs that some of the outputs have been accomplished. Planetary Health Education Framework and Toolkit have been developed together, and we are currently developing the planetary health courses at each Asian partner. And then we have started some faculty development training of trainers on planetary health education. And the massive open online course is also undergoing in development, and we're going to implement this particular course next year in 2026, which will involve not only academic institutions but also community partners. And we will offer these modules for higher education students, not only from medical medicine, but also from other healthcare professional students and also students of any discipline or subjects. So this is the roadmap of parental health education delivery. Basically, we have to um, agree on the competencies and the framework of the educational framework of planetary health education, and we will move on with equipping our teachers, training the trainers, training the teachers to be able to deliver this planetary health education concept and content. Because in from Unifras Indonesia, most of the members of the team are from Faculty of Medicine. We really feel that we don't have the all the knowledge that is required to discuss about planetary health education. Hence, it is very important in planetary health education that we are collaborating and uh, collaborating with everyone that is also the expert in planetary health education. So we in developing our curriculum, in developing our educational modules, we work together with other schools in the university. We involve experts from different fields, not only from medicine, but from outside of medicine, because it is very much a transdisciplinary field. So here is the framework for the project output. So there will be, as I've mentioned to you before, we have been producing the education framework and toolkit, and then we are currently developing the online course, and also we have started to do the faculty development. So here are the milestones so far. Because of the time constraints, I won't be able to go to each content in detail, but just as an overview, we did a scoping review analyzing all the curriculum of planetary health throughout the literature. And from that scoping review, we developed the frameworks and we provide recommendations. And then we identified shared resources for planetary health education delivery. And because we're going to deliver the planetary health education as an online courses as well, we have created a navigation guideline for the development and hosting of e-learning courses. So here's the scoping review or the environmental scan that I have mentioned to you before. So based on the scoping review and the environmental scan, we have managed to identify a total of 125 courses in the literature and the websites, which were listed with various titles and degrees spanning from open access course to doctoral degrees. And all of the 125 originated from high income countries, except for one from the Philippines and one that is a collaborative project between Germany, Kenya, and Tanzania. And within that 100 plus courses, they use different modes of delivery, whether it is in person, online, and hybrid. So from this environmental scan and scoping review, we identified that there is still a lack of standardization of the conceptual frameworks, competencies, and the teaching methods related to planetary health education. There are still challenges in curriculum development and quality assurance. And this is perhaps very, very important that there are still inequities in the implementation of planetary health education, because the planetary health education as it is existing now is still concentrated in developing countries. So one of the project that we did in the Kata Earth Initiative is also doing the co-creation activity, where we involve diverse group of participants from various institutions, from academic institutions, from governmental sectors, and also from the NGO. And we did an empathizing activity there where they explore their personal connections with planetary health, and then they created ideal persona to identify the skills, abilities, and aptitude necessary to be a success in this planetary health field. So the co-creation activity produced a persona called Catalina Earthfield, which this particular persona consists of various skills, knowledge, abilities, and attitude that would help us to then further explore the competencies of planetary health. So I think this is the last slide. So as a takeaway points, unhealthy planet will definitely have a profound impact on human health. So, from at least from our side, from the School of Medicine or the Faculty of Medicine, we believe that health professionals should be equipped to mitigate and adapt to the crisis. So, we need a curriculum on planetary health education that can be incorporated into existing curriculum, including in medical and health professions. So perhaps some medical schools have now planetary health education, but maybe it's still informal, or it's still as an elective course where not everyone needs to take that course. So we need to make it more formal and obligatory for everyone. And the extent of the integration, the competencies, content, teaching, and assessment are currently very varied. So, as I've mentioned to you, there's a lack of standardization. So, at least there should be some minimum requirement or standardization that should be formulated based on the available evidence. And also, we need to fully aware that collaboration and multi or transdisciplinary is the key to the success of planetary health education. Also, the importance of teachers, faculty development is, I also believe, as the key success to this planetary health education. So, thank you very much. I would pass on to the next speaker to present his talk. Thank you so much.
Hi, George. I can't hear your voice. Can you make a device setting and then allow the microphone? Yeah, go to the three button on the black box. Please allow the mic on the device setting. Then allow the mic, the button gear.
Is that any better? Can you hear me now?
Yeah, it works. Good.
Sorry, everyone. Technical issues, I suppose. Always a challenge. Always a challenge. But here we go. Okay, we're back. Um, so thank you very much. Good morning, good afternoon, everyone. Thank you for inviting me to the session to especially talk about water sanitation, hygiene, and its relation to planetary health. I'm going to take this opportunity to really talk fairly broadly and try and cover some of the major ways in which the planetary health concept applies to WASH, especially in terms of how planetary health disruptions impact WASH, before then passing over to Irena and Daniel to talk a bit more specifically. So I think just to briefly start with, I think we're all fairly aware of just how important adequate access to wash resources are in our day-to-day lives. And over recent decades, especially over my career, we've been seeing some pretty significant improvements, not everywhere, of course, but widely speaking, some fairly significant improvements in WASH, especially in terms of access to potable water and accessible toilets and accessible sanitation. Um, these resources, these things have notably improved in previous decades. However, as the planetary health crisis continues to develop and advance, we're seeing a lot of the advances that we've enjoyed over recent decades really come under risk. And interestingly, with regards to the planetary health crisis, it's really sort of two sides or two contradictory sides to the WASH dimension. As on the one hand, as our planet warms and we get increasing droughts, we can get increased challenges or really restricted access to potable water and disruptions in food systems. Whereas on the other hand, as our weather systems change, we can find ourselves in situations of increased floods, which introduce risks of infectious diseases and infrastructure and so forth. And then, of course, there's the interrelation between the two, as dry, hard soil can impact the degree to which rainwater gets absorbed, further contributing to flooding. And then, of course, in the context of urban communities, especially vulnerable urban communities, such as those living in informal settlements, both extremes are exacerbated on the background of challenges such as persistent deprivation, inequity, limited infrastructure, and so forth. So when we look at sort of the role of vulnerabilities and climate vulnerabilities and how they relate to exposures, this is a really broad topic covering a very wide, very diverse range of individuals. And I really like this photo, partly because it's one that I took. So I took this photo a couple of years ago when I was visiting Cartagena. And this is a city which is especially experiencing and acutely experiencing the impacts of climate change and the planetary crisis on WASH. And here we're seeing that every time there's a significant amount of rainfall, which is pretty common for tropical environments, the drainage systems often struggle to cope and you get widespread flooding. So this photo was just outside the hotel we were staying at. And these wee trolleys that are visible just in the corner here represent some ways in which usually enterprising young men were dealing with the simple challenge of not being able to cross the road. You'd climb on the trolley, they'd take you across so you could keep on going your ways. And this sort of issue, this sort of exposure to WASH-related disruptions is really one that resonates around the world, as increased rainfall, seawater infiltration are really important aspects of the climate crisis, and are ones that we're really seeing more and more commonly among urban populations. And all of this sort of contributes to sort of growing and ongoing disease burdens. Again, sort of coming from this two-sided or this flip side of the coin type challenge that the planetary health crisis is providing. On one side, we've got increased temperatures, which exacerbate dehydration, exacerbate water scarcity, which means that in times of extreme heat, we can see an increased likelihood or increased incidence of acute diseases such as acute cardiac events. But then on the flip side, of course, we get back to this flooding challenge where rainwater can submerge latrines, which can introduce diarrheal diseases. And we see this very commonly after flooding, right? The outbreaks of cholera and other infectious diarrheal diseases become very common. And in fact, another aspect of the WASH crisis in urban and especially coastal settings that I'm becoming acutely aware of through working with people like Diantha, who spoke before us, is the increasing impact of saltwater infiltration on people's livelihoods and also on their personal and dermatological health, as increased in pervasive exposure to the saltwater wreaks havoc on people's skin. And so even though we're seeing more and more information about the pervasiveness of the disease burdens that people are experiencing, there are still huge amounts of evidence gaps, large knowledge gaps that we are seeing across the board, especially at sort of the granular community specific levels, where a large amount of the disease burden, a large amount of the specific challenge really depends on community and context. And this is where vulnerable urban populations, especially informal urban populations, are especially at risk, because people that don't sort of typically exist or operate within the traditional system are really at risk of just being overlooked or being not seen, and therefore we don't have a good idea, we don't have solid evidence bases for how to approach and adequately support these communities. despite these challenges, despite these sort of health problems, these evidence gaps, I really want to sort of make sure that we do highlight that there are many things that are being done and that we can do in the face of wider planetary disruptions and water sanitation and hygiene. And the great thing with a lot of the adaptations and actions that people can do or that communities can do is that we're not really needing new technologies or new discoveries. It's really sort of implementing a lot of what's already known and identifying sort of those populations that need things the most. And urban planning, for example, is a great place to start, such as the installation of climate resilient sanitation, where toilets can be installed to be more resistant to flooding. Also, the active use of green spaces to help reinforce soil and help sort of with water filtration and cleaning. And also through all of this, maintaining routine, regular public and community engagement so that those communities and populations which are at danger of being overlooked become actively engaged in adaptation strategies and be part of the message moving forward in terms of responding to WASH challenges. So if I just very briefly sum up this short overview I've given, the disruptions to our planetary systems are really pushing extremes in terms of WASH. We're seeing worse challenges in terms of floods, but also in terms of droughts, which is placing our WASH systems at increasing stress from two different directions. Socioeconomic vulnerabilities and knowledge gaps do pose additional risks, especially for vulnerable populations. But if we prioritize resilient infrastructure and community-based actions, we have the very clear opportunity to empower those groups who are most at risk so that they can have the appropriate tools, knowledge, and other opportunities to adequately act and address those challenges. And with that, I will wrap up. Thank you all very much for your time. I will pass the floor over to Elena to take us through some further examples. Thank you, everyone.
Okay, can you hear my voice now? Okay, I think it's okay, yeah. Hello everyone. So I'm Irene here. So I will talk more about bring a perspective how the connection between climate and health in the urban context, as previous speaker also mentioned about that. But I will add with the existing governance in Indonesia context. I will give you some examples how the existing and our plan deal with the effect of the climate extreme impact with the health issues in Indonesia, especially in the health services. So yeah, I start with this thing whether the urbanization is is natural, but it creates problem, especially in like our cities in Indonesia, in the global south cities. This urbanization is very natural, but this expansion brings major social and economic challenge. And we deal with the deep structural issues. We talk not only about the infrastructure, such as like traffic, but also we are talking about with the social and economic impacts like widespread poverty, or like one of the issues is about the housing shortage if we are talking about the infrastructures. So the climate extreme is make it more severe for the vulnerable people. So these existing urban problems are made much worse when a big stress like extreme weather happens. So just we can see from our examples in three big cities in Indonesia, especially in the Java Island, in Jakarta, Semarang, and Bandung. In Jakarta, we had extreme flood in March uh, uh, 2025, also in Semarang as a coastal cities, and also in Bandung. So the biggest causality is in the public health. So the combination of the urban vulnerability and the climate stresses directly raise the risk of health, the risk of the poor health status. So specifically by boosting the transmission of infectious disease. So our response is currently is reactive, more reactive, not preventive. So the situation calls for robust countermeasures from the upstream until the downstream. So sometimes mostly we almost focus in the curative side, but I think we are now start thinking from the upstream. So this is we need to shift our focus, and then the key takeaway I think that we urgently need to, like I said before, prioritize the preventive actions. So then this is the causal pathways from the climate change to the urban health inequity. By this model, we know that this framework, understanding the complex mechanism through the global climate change translates into urban health inequity. I think from the several speakers previously, we also know about these climate effects make the inequity of the health status. So for the first phase, the foundation and the global drivers, the global climate change serves as the primary physical driver, manifesting as increased greenhouse gases like the more extreme weather events and unstable rainfall and atmospheric changes. It also happened in Indonesia. However, these physical changes, I think, do not occur in a vacuum. So they are also shaped by the key global and national influences, like how the governance structures, national policies, cultural norms, and technological development. And also about the local filters and the social sorting. The influences then flow down to the city level, where the key city or like the municipal level factors such as local legal political structures or capacity of the local government and the city population size mediate the response to both global influence and also the climate effect, climate extreme effect. So I think these local factors directly contribute to the social stratification that determines like education, occupation, income, and gender, which effectively sort the urban population into groups with vastly different life chains and resources. And the last phase is the mechanism of inequity itself. So the social stratification determines of two major types of differential exposure and vulnerability. So in simple terms, your social position will direct how hard the effect of the climate extreme. And this physical and social environment make it stratified groups how uh, stratified groups have differential access to the basic needs like poorer housing quality, weak social infrastructure, and reduced access to health services. So this vulnerability become pre-existing of the effect, and also the climate exposure. Yeah. So this climate exposure make the stratified group face disproportionate exposure to the climate hazard themselves. This means that the physical hazard from the global climate change are amplified by the underlying urban complexity, which is rooted in social inequity. And then I will show you about the condition in Indonesia cities. I make example from the coastal city. So this is mostly in the central Java cities. So this the picture is show about the small cities, small coastal cities in the West Java, and I also add Jakarta as metropolitan cities that also face with this impact of the climate extreme. So the increased disease burden from the climate extreme, as I found from this ongoing research. This is my research in the MAC cities, funded by the Global Development Network Research. I found that the increased disease burden from the climate extreme usually we found like various disease, including like skin disease, diarrhea, and also like the infection disease. So there's inadequate health infrastructure also. There's in the coastal urban areas often pose minimal or deficient health infrastructure and exacerbated with the comorbidities, existing illness from the vulnerable group here. And I think for residents already managing chronic health issues, the precondition, their condition worsened significantly because of the flooding, because they already live with the water, and because of the flooding and the infrastructure damage make accessing routine health services incredibly difficult. So this is like the example what happened in coastal cities like in Indonesia. And then what is the existing countermeasure if we are talking about the health services? So in our case, the public health system and broader policies in Indonesia provide actually a solid foundation for the poor and the vulnerable to increase the resilience. But I think it is in national level, and so it's focused on the general coverage. So we have like the universal health coverage, and also national health insurance program that we can put this existing program become an entry point to consider about the climate effects, because and now for now there's a lack of targeted health action programs specifically designed to tackle climate extreme in wide and national level. And then we have also mitigation is mapped, but the action is still lack. And then we still remains on the curative treatment, like I said before, like the universal health system, and also we have also JKN. It's inherently channels resources toward treating disease after they occur. So just the effect, so they come like treating diarrhea, and then they can use this mechanism to treat their illness. And siloed efforts of the ministry level become also the issues. The Ministry of Health has established dedicated teams and committees. However, the effective translation of their recommendation into standardized, localized, and also operational action programs remains a challenge. And the climate-induced diseases are addressed effectively, the ministry focused on addressing the rise of specific climate-sensitive disease, while the important disease essentially are reactive effort. And I think that the future governance, I think we need to integrate the how the social protection programs, the existing one with the climate resilience and also the health resilience, uh, and combine it become a one treatment that make a comprehensive approach. So it moving from the silo approach toward integrated strategy. So if we are talking about this integrated strategy, I think this is my last slide. We are talking about the adaptive social protection that can be one option to make the how to bridging the health issues with the can tackle with the social protection programs in Indonesia, and also the disaster management in other hand. So this adaptive social protection, I think we have four pillars for to make it happen. It consists of the how the arrangement from the institution, and also how the institution can deliver the programs to the vulnerable group. And one also important is about the data and information system. And I think mostly that we need to consider is about how the financing mechanism. So so the issue about the health causes by the climate extreme effect can be tackled integratively, and also uh, right to the uh, right to the target, especially the local people who get the impact of, or who get the effect of these climate events. I think that's all from my side. Uh, Thank you very much. Back to Daniel.
All right. Thank you so much for Mbak Iran. It's really good and it's great presentation. So now I'm really excited to be here. Then presenting my research on situated live experience of wash insecurities in Jakarta's urban kampung. So my name is Daniel. I'm a PhD candidate in human geography and spatial planning in Utrecht University. So I'm working with Jay Bailey and Mukahid Bayrak through this project. So my first slide is about to say that it's a simple but powerful observation that people who live in the same city, but we have an equal access to basic wash services. Next slide. Can I do a next slide? Yeah. And then this inequality has a story because over the last years, decades, water privatization and fragmented sanitation project have deeply shaped access in Jakarta. Despite, next, yeah, next. The article our constitutions after the amendment states that the earth, water, and natural resources are controlled by the state and used for the greatest prosperity of the people. In terms of access to clean water and sanitation remains highly unequal. Next slide. Yeah, this indicates that globally about 56% of our populations will live in cities, and by 2050 this number will rise to nearly 7 in 10. And in Indonesia, urbanization has accelerated, bringing not only economic opportunities but also pressures on basic infrastructure, especially in informal settlements that grow faster than planning system can respond. Next slide. This is my case study that focuses on Kampung Johar Baru, a dense urban kampung in central Jakarta. This is one of the many informal neighborhoods that face multiple insecurities like unreliable water supply, poor sanitation, and exposure to environmental hazards. Next slide. This is a WAS insecurities that I analyze. There are four key dimensions. So the accessibility, affordability, acceptability, and adaptability. These dimensions reveal how households navigate the uncertainty, from finding water sources to paying private vendors to improvising sanitation facilities that are socially and culturally acceptable. Next one. So I work with the community leaders. I work with the community itself in order to building rapport, conduct in-depth interview, and also observations. Next slide. Yeah, most of them are hawkers and street vendors. They also have small industry and daily laborers. Next. And I also conduct transect work that I documented scenes of water storage, how they having an open defecations and household waste disposal directly into canals. And these practices are not simply a matter of behavior; they are shaped by limited sources, infrastructure neglect, and the physical and social layout of the kampung. Next slide. Here we see other daily uses of water: washing, doing laundry, or cleaning dishes, often in shared or improvised space near polluted canals. Next slide. Yeah. This slide. Residents are aware of the risk, but they constantly balance health, costs, and convenience in ways that reflect local adaptation and resilience. Next slide. And at the same time, issues like clogged sewers, stagnant water, and poor drainage create conditions for mosquito-borne disease and rat infestations, linking environmental degradation directly to health outcomes. Next slide. And even the social protection and healthcare services exist. I think next slide. Yeah. Even that social protection and healthcare services exist, but they're often limited in scope or reach, leaving communities to rely on self-organization and mutual support. Next slide. So what do these findings tell us? First, wash insecurity in Jakarta is not just a technical issue, it's also a social, political, and historical. And second, local coping strategies show adaptive capacity and collective agency, but they should not replace the responsibility of the state or formal institutions. By situating this lived experience within the planetary health approach, we see how environmental degradation, governance failures, and everyday resilience are interconnected. I think the next slide. Next slide. Yeah. Uh, so I try to unpack what is the multi drivers of the coping strategies, or how drivers can shape the coping strategies within this kampung community through the underlying drivers, ecological drivers, proximate causes, and also the modifying factors that shape the situated life experience within this kampung through a planetary health approach. I think that's all my slides. Do we still have time to have a question and answer, Sabrina? Because it's really uh, packed. Or
Okay. If people
yeah,
have questions, maybe in the audience, or does anyone else have questions?
maybe one questions because it's already the time
Yeah.
is out.
Or we do like a key takeaway, one word takeaway from
Yeah,
each presenter.
sure.
That would be also good. Maybe we start from you, Daniel. You got less time compared to us, so you should start. What is your key takeaway, and then we go around.
So yeah, thank you so much, Ajay. My takeaway is first that based on my fieldwork and also my research, that wash insecurity is in Jakarta or within this kampung is not just a technical issue; it's also a social, political, and historical things. And the second is that the local coping strategies show the adaptive capacity and collective agency, but they should not replace the responsibility of the state of formal institutions. That's all.
Thank you, Irina. Short one.
Okay, good afternoon, everyone. My name is Shiva Maria from Diponegoro University. For this issue is about planetary health and also the wash. Actually, this is related to my study, that environmental health and public health. For the first question is, I want to
I'm sorry, I
know.
can't hear the. It's very as though it's in a tunnel. I hear the sound.
Okay, for the first question is about the curricula, planetary health curricula. Is this curricula start for the elementary student or other stage like junior, high school, or maybe for the university student? Because every stage of school that have different difficulty of teaching. So how the government prepare the training of the teacher for this curricula? That's the first question. So the second question is one of the
Let's
outcome.
take one question because then there's time enough. Maybe the answer can answer that question. It's on curriculum. Short
Thank you.
answer, and then we go ahead.
Yeah, thank you very much for your question. I believe it should be continuous from elementary and up until university. But of course, we can have different focus for each of the stage of education. For example, in elementary school in Indonesia, we have the program of health literacy for elementary students, for example. In that particular topic, for example, we can incorporate introduction on climate, and we can, teach them to how to, separate trashes and so forth, to recycle. I think that's a part of the planetary health education. So we can make it formalized, integrated into the curriculum, but we can also nurture them in some aspects of more sustainable living. I think it's very much appropriate to be introduced from elementary to university, but of course different level would require different focus, and I think that's where a framework of planetary health education, not only in the university level but also starting from the elementary level, is very important, and we can examine what is already there for each level of education, and then we can infuse whatever necessary that we think necessary to be added into the existing curriculum and educational program at each level. I think that's my take. Thank you.
Thank you.
Perhaps other resource person would like to add.
Yeah, could we quickly, George? What's your key takeaway? We don't hear you as yet.
Maybe Iren can start,
George.
and after that George, because George is have a technical issue and
Oh, okay.
yeah.
I think just want to jump in for the curricula issues because if I'm not mistaken, about the climate sector, how we integrate the climate effects with the social sectors. As in Indonesia, we still don't have like the standard standard mechanism like in the national level for how to integrate, for example, in education system, how to integrate these issues to the curricula, for example. What happened is the activities is like initiated by the province or the local level. Like for example, we have like I don't know in English, but in muatan lokal to integrate. Muatan lokal means like local initiative in each school that put the climate change issues or climate change countermeasures to the programs in the schools. But I think for the national standard, we still lack of that things.
Yeah.
I
Thank
think
you.
it's my comment. Yeah.
George, do you want to?
Can you hear me now?
Yes.
Yes. Okay. I think so. I'm just going to go straight back to the key takeaway, and I think my key takeaway from my talk kind of links a little bit to what Daniel was talking about. How, um, you know, solutions to our many challenges are there, and it is important to have policy makers take some responsibility, but it's also vitally important to make sure that the local communities and local stakeholders are engaged in the decision-making process. That's my key takeaway.
Right. There's one more question before we end the session. Can the person please pose the question?
Can you hear me in the
Yes.
screen?
Yes.
Okay, that's great. So, hi, my name is Nathalie Vickers-Melchers from the Wageningen University in the Netherlands. I loved all of your presentations, but my question is regarding the last one. I thought it was very interesting to get an idea of the problems in Jakarta, and I actually crossed that neighborhood myself, so I did see the slums. Um, my question is regarding one of the slides that you showed very briefly about the differences in infectious diseases. Are those self-reported infectious diseases, or did you couple it with surveillance data from this specific neighborhood? For example, did you do some entomological larvae studies for your vector-borne diseases? Thanks.
Okay.
Daniel.
Yeah, yeah. I will answer briefly because I'm not a health practitioner. I was an urban planner by training. So based on my observations, they have some of diseases because of they live with the rats. They live with some kind of a dirty environment. So maybe this is the insights for the health practitioners, or maybe another scientist to moving forward with these issues based on my research.
Yeah.
Yeah.
But the sheer existence of a lot of waterborne infections and that the area is endemic for dengue and other kind of things is clear indication of
Yeah.
this availability of larvae there. So yeah, I think that's a good point. Yeah. Okay. We would like to close the session. Thanks a lot for everyone for participating. Um, Thanks also for the people coordinating the technical parts. There are glitches, but we got our message through. Thanks a lot for supporting us, and have a great day further at the conference. Thank you. Bye.
Thanks, everyone.
Thank
Thank
you.
you.
Thank you.